If you suffer with massive anxiety or panic attacks, it could be a symptom of a hormonal imbalance. And the good news is it can be treated naturally. Dr. Stephen Hotze is the founder of the Hotze Health and Wellness Center, and he's here to tell us more about this natural solution. Let's start off by talking about what is an anxiety attack.
An anxiety attack is a chronic agitation or restlessness or apprehensiveness that can't really be described. It's this feeling that you have of apprehensions, that something's not right, as opposed to a panic attack, which is an acute sense of overwhelming fear for no apparent reason. And these commonly happen to individuals as they mature and march through their lives. Women particularly as they march through their menstrual life. This is a very common complaint that we see.
See, now, I have never experienced a panic attack, but I hear about women and men,
they'll be driving in a car and all of a sudden they'll just have this overwhelming sense of fear for no apparent reason.
So what causes it?
Well, the common cause of this is the decline and imbalance in our natural occurring hormones, which are simply chemical messengers which are secreted by specific glands, the thyroid gland, the sex glands, ovaries in females and testicles in males, and the adrenal glands. The hormones that are secreted instruct our cells what to do. And as our hormone levels decline or become imbalanced, it affects the cellular function in our bodies, particularly the brain function. And so it affects our ability to produce the natural occurring neuroendocrine hormones that help us think well and feel well and be calm.
So anybody could experience this at any point?
Well, that's right. Anybody can experience it. Sometimes anxiety is real. You know, we're worried about finances, worried about kids, worried about jobs and those sort of things. The common treatment of this, when people go for treatment, unfortunately, they're often placed on drugs. They're placed on anti-anxiety drugs like Ativan or Xanax, or they get antidepressants like Prozac and Zoloft and Effexor, which simply mask the underlying problem. It doesn't get rid of your financial problems when you take drugs. It doesn't get rid of the problems you might have with your husband, a problem with the kids. It simply masks the problem. But it surely doesn't correct the underlying hormonal imbalances which so often occur in individuals in midlife.
So let's back up a little bit here, because I want everybody to understand when an anxiety attack becomes a real concern, because as you mentioned, there are times, holidays, when you do feel a little more anxiety and stress. So how do we distinguish between what's normal and expected and when we need to seek further help?
Well, if it's something that's acute and you get over it, once the holidays are over, you feel like, glad that's over, I feel great again. But if it doesn't go away and you're having this on a reoccurring basis, that's something that you need to consider. Could it be an underlying hormonal imbalance that's causing this? Never are anxiety attacks caused by low levels of drugs in our body.
Right, because that's not a naturally occurring.
Those aren't naturally occurring. So if you have this chronic and recurring feeling of agitation or stress, or let's say it's cyclical. Let's say in a woman you notice that this happens cyclically before my menstrual cycles. Well, it's got to be hormonal.
So here we go again. We have a decline in the progesterone.
Progesterone is the hormone that most dramatically declines as women mature. They make two hormones primarily, estrogen hormones and progesterone, in a 28-day cycle. All month long you're making estrogen, you ovulate, then you make progesterone. The progesterone balances the estrogen. As a woman matures, the progesterone levels decline. In fact, women as they mature don't ovulate every month. When they don't ovulate, they make no progesterone. So oftentimes women will say, some months I feel much more agitated, much more restless. My mood swings are much worse than other months, and that's due to progesterone decline. And that can be easily treated with natural occurring progesterone.
But if it goes untreated, then you can have other hormonal imbalances as a result.
Well, absolutely. What does that lead to? When you have estrogen dominance and low progesterone, then all of a sudden you get change in your menstrual cycles, you get the clotting, the bleeding, the menstrual cramps and irregularities, fibroids, and these sort of things, which can lead to a whole nother problem, and that can lead to hysterectomies, and that doesn't correct the underlying problem. The underlying problem as we age is a decline in our natural occurring hormones, which are those chemical messengers that instruct our cells what to do.
And how to respond.
And how to respond. As we lose those hormones, then our bodies don't function as well.
Interesting, interesting. But it's wise to have it treated sooner than later, because then you avoid that domino effect of everything now becoming unbalanced in the body.
Exactly.
All right, Dr. Hotze, always so good to see you. Happy New Year to you. To
you too, Brenda.
All right. Dr. Hotze's radio show, Health and Wellness Solutions, can be heard Monday through Friday from 12 until 1 p.m. on 1160 AM KVCE. You can find out more about the Hotze Health and Wellness Center by calling 877-698-8698 or by logging on to hotzehwc.com. Up next, Gary's